Hi, I'm Dr. Adam Zuckerman. I'd like to welcome you to my Spinal Decompression website. You're going to see on this website that there's a request box for free information and a free report regarding your disc condition and how we could potentially help you. I've been in practice since 2004 in Boynton Beach, Florida. In our office, we take pride in keeping up with the most advanced ways of treating your chronic pain and conditions. Are you suffering every day of your life with back or neck pain, leg or arm pain, burning, numbness, tingling, foot or hand pain, burning, numbness, tingling, weakness, atrophy, stiffness, fatigue, inability to perform your regular daily tasks or play the sports that you love like golf and tennis, spend time with your family and friends? These are the most common symptoms and signs that you potentially have a disc problem in your spine. If you're suffering from a disc problem, you probably already tried the most common treatments that are used, despite very minimal results. Things like physical therapy, which includes stretching, exercises, heat, electrical stimulation, epidurals, which are anti-inflammatory steroid injections into your spine, another round of epidurals, surgery, another surgery, neuromodulation, traditional chiropractic care possibly. Let's give you some facts about surgery and epidurals. Statistics show that 1 in 100 low back surgeries are actually successful in relieving your pain. Most surgeries take place again within 1 to 5 years. Spinal decompression is the most successful procedure, which is actually the least invasive. There are no drugs or surgeries and no harmful side effects like drugs or surgery. Non-surgical spinal decompression is actually an FDA-cleared procedure that's used to treat pain related to protruding and herniated discs, degenerative disc disease, facet joint disorders, spinal stenosis, spinal nerve root impingement, degenerative disc disease, and hypomobility. But how? Let's start by talking about the purpose of your spine and the anatomy of your spine. Your spine is made up of 24 movable bones called vertebrae. These vertebrae have the same job that your skull has. The job of your skull is to surround and protect your brain to keep it protected. The job of your bones of your spinal column are the same exact thing. They surround and protect your spinal cord. And the reason why your spinal cord needs to be protected is because the way that your brain communicates with the rest of your body is through the spinal cord on the inside of your spine. It's about the size of your pinky in diameter. And coming from the sides of your spine are nerves which branch out and go to things like muscles and organs and glands and pain and sensation. So, zooming in a little bit further, we have discs. And that's why you're on this website. Discs are, the analogy that I like to use, are like Ziploc bags filled with water. If you put water into a Ziploc bag and you sealed it, that would be a disc, but a little bit thicker. Now, if you took that Ziploc bag of water and you squeezed it, and actually squeezed it, it would create a bulge. That analogy is a disc bulge. If you squeezed a Ziploc bag of water and it made a bulge, but then you popped it with a little pin and it started oozing out like a ketchup packet, that would be a disc herniation. Now let's explain to you what would happen in your spinal column and what would take place if you have those. The first thing is that you have to understand your disc is actually a spacer between your spinal bones. The bone above is shaped like this, the bone below is shaped like this, and when you put the disc spacer in between, it creates a wide open hole for the nerve to come out and to function. So the first thing that happens when a disc squishes down like a moon pie, the hole will actually close down and put pressure on the nerve. Then what you have to understand is that the disc will bulge. It doesn't evaporate into thin air. The disc will either bulge or herniate, just like as if you squish down that moon pie. It would go to the right. It will bulge to the left. It could go to the right or to the left. It could go backwards towards the spinal cord. If it goes backwards towards the spinal cord, the most common diagnosis that you get is spinal stenosis, which means a narrowing of the spinal canal because something's occupying it. And in the majority of cases, it's actually the disc that's occupying it. So the double whammy takes place. In addition to the spacer decreasing and closing down the hole onto the nerve, you could actually have the disc material then pushing on the nerve as well. So what spinal decompression does, we focus on gently stretching out your spine, creating what they call a vacuum effect. It allows space to form in your discs, so when the table decompresses and relaxes down, it creates a suction which would potentially bring disc material back into the disc, away from the nerves that are causing your pain. So let's talk about the goals of spinal decompression. Decompression will relieve pressure on your nerves, decrease disc bulging, open up your nerve holes called foramen, It will result in mobilization and will stretch ligaments and stretch your joint capsules. It'll decrease muscle spasms and decrease inflammation. And it'll stretch and relax the tense tissues and get motion in your joints. What should you expect of non-surgical spinal decompression? You should expect symptomatic relief, decreased in back pain, increased range of motion, decreased muscle spasms. You should have a functional improvement and increased participation in the daily activities that you love. Let's get you back on a golf course or tennis court. Increased performance at work, the ability to spend quality time with the people that you actually care about. Sources of neck and back pain aren't just discs. They could also take place, back pain can result from muscle spasms. Muscles are just like armor. If there's a problem underlying at the spinal level, the job of your muscles is to tighten and to protect anything further from happening and to stabilize it. So you could actually have chronic muscle spasms, and you could have problems with your joints and the nerve roots. So if you're suffering from pain and tingles and numbness, it could actually be a combination of those problems. So what makes us different is that your spine is made up of 3 components: your bones, your muscles, and your discs. We leave no stone left unturned to evaluate all 3 components to ensure optimal success with your condition. Why would we leave any parts out? Therefore, therapies and massage actually may be needed in your protocol in addition to spinal decompression in order to achieve maximum results. So the next logical step is a comprehensive evaluation in order to determine if you're a candidate for non-surgical spinal decompression. Just because you have a disc problem doesn't mean that it's safe and effective to use with you. So we need to collect all the data from our office and from the other doctors and MRI facilities that you've been to in order to thoroughly evaluate your case. We need to piece together your jigsaw puzzle to make sure that we can help you with your suffering. So what you need to do is ask yourself what your life would be like in the next 5 years if you don't seek proper treatment. Will you need a surgery? Will you need more injections and more drugs? Will you have pain that will get even worse? So once again, the next step is to give us a call in order to see if you qualify. Testing needs to be done in order to see if you're a candidate for non-surgical spinal decompression. We need to determine if the table will be safe and effective for your specific problem. I would love to add you to our long list of success stories and help add value back to your life. I hope you learned a lot from this video, and I look forward to hearing from you soon.